Okay, so let's discuss men's health and some of the key things to be knowledgeable of when you are dealing with men, and just some trends that are happening in Australia and also in other industrialised, westernised countries such as America and United Emirates, UK. Because there's quite a few things that really are quite preventable, actually, when it comes to men's health. So I'm going to cover three main things that are affecting guys, and I'll weave in other facts as they pop up as well. Just some things to look for with these three main issues and how you can assist them and guide them to get the right treatment. Now, life expectancy for Australian men. Now, this is, sorry, we'll just go back to that one, 2013, and this is taken from Australian Bureau of Statistics. Currently it's 79 years, and interesting, women live on average an extra 5 years. A few reasons for that. And this, though, last year was the first year in the beginning of this year that a child born in 2012, 2013 in this country has an equal chance of making it to 100. Worrying trends. Look, a huge amount of Australian guys are overweight. 70% just in Queensland, so 7 out of 10 men up here are overweight. Still to this day, which really does baffle me, heart disease is the #1 killer, and it accounts for 40% of all guys who are dropping dead. So 4 out of 10 guys who die in this country, it's due to heart disease. Now, heart disease does encompass stroke and quite a few different, subcategories, but essentially most heart disease is preventable, and I think for me that's the tragedy, that still in 2013 we're not curtailing that at all. In 2010, 1 in 6 couples are infertile. It used to, maybe 10 years ago in the year 2000, it was 1 in 10 couples that were infertile, and majority of the issue was lay with the woman. Now in 2010 it's 1 in 6 couples, and now half the issues are due to the guys. So men's reproductive tracts are actually getting worse. And unfortunately, this one here is a major concern, and I have quite a few young guys that do really worry me, because mental health in young Australian men is quite drastic, and it is the 10th leading cause of death in young men. Now, here's just some statistics here on mental illness, because it's costing us a huge amount. And this is just an aside. I'll talk a little bit about depression in guys, but you can see the cost here per hour is quite remarkable. It's nearly $400,000, so nearly $500,000 each hour is lost due to men who can't hold down a job or who can't work due to mental illness. Now, the big killers in Australia, and as I said, quite reflective of other industrialised, westernised countries: heart disease, trachea and lung cancer. Now, that's probably in your older populations, because interestingly, smoking rates have dropped off quite significantly for guys. It hasn't for girls, though, and the uptake of cigarette smoking is still quite high in young women, which is a bit of a head scratcher, that one. But I guess when they see, they think, young women think smoking sexy, they know it's an appetite suppressant. I guess, at that young teen age to early teen 20s, being lured into smoking is something that's quite attractive. Unfortunately, it does lead to trachea and lung cancer, no doubt about that. Strokes up there, prostatic cancer, and that's another one that's gone through the roof in recent times, and lower respiratory tract diseases, so emphysema, asbestosis, pneumonia. And as I said, the 10th leading cause of death in Australian men is suicide and self-harm. And we'll talk more about that in a minute. So National Male Health Policy has been launched by the Department of Health and Ageing, because it is such a men's health is such a hugely preventable area in a lot of zones, as I've just highlighted. Just going back to these: heart disease, quite preventable; lung cancer from smoking, very preventable; stroke, also quite preventable; prostatic cancer, from where I see it, from a hormone imbalance, low vitamin D, high estrogen states, low testosterone states, low zinc states, very preventable; lower respiratory diseases, depending on which ones we're talking about, whether they're preventable or not. So this Men's Sheds in Australia is actually a program that's been rolled out by the Department of Health and Ageing. You can Google it, and it is aimed to enlighten men on just health options. This is a really good slide, if you ask me. It just shows preventable causes of death. Now, this has actually changed. This is from Wiki, but in Queensland last year, I read the health reports every year, the annual reports. Actually, sorry, it's 2010. Being overweight or obese actually superseded smoking as the highest risk for causing death, or preventable causes of death was this one now, overtaking smoking. So I think this is quite important if you are in the weight loss industry or any health related profession where you're helping people. We really need to take home, impart upon to our clients that being overweight is unacceptable. It's just not good for your health in any way, and most people would find smoking abhorrent. Well, they need to start viewing being overweight or obese in the same vein, because it is a high, it's probably, well, it is now deemed the highest cause of preventable deaths. Alcohol-related infectious diseases, toxins, motor vehicle collisions. So you can see all these things here that they're preventable, and as I said, this one here is now superseded smoking. Now, cardiovascular disease, something very close to my heart, excuse the pun. Being a coronary care trained nurse and over the years working a lot in coronary care units, which is where you specialise in heart medicine, I really love working with the area, and I find it fascinating, and I still, as I said, scratch my head how 4 out of 10 deaths in this country in men still due to a very preventable disease. So cardiovascular disease really encompasses all the vessel disease, so that can be arterial or venal diseases, heart issues, blood clots. And just on the blood clot thing, actually, I was talking to someone about long-haul flights, so any flight over 10 hours. One study showed that 30% of people who embark on a long-haul flight will have a DVT, but most of them, or all of them pretty much, are never picked up. But someone who drops dead 6 weeks after a long-haul flight from a pulmonary embolus or PE, probably due to the long-haul flight. Ischemic diseases, diabetes and stroke all come under cardiovascular disease, largely preventable. 30% of people die from their first heart attack. It's a massive statistic. They don't get a second chance. Of the survivors, so, you know, of the 2 out of 3 who do make it to a hospital and revived, a further third of those are dead after the first year from heart failure or a second infarct or something else going wrong there. So the risk factors for heart disease, and you'll probably find this with all the preventable things, as I said, weights now superseded smoking. Haven't got smoking on there, but smoking definitely should be on there because it causes a lot of vasoconstriction. And smoking also chews up vitamin C at an incredible rate, and vitamin C, naturally occurring in foods, is one of our greatest antioxidants and mops up a lot of free radicals. High blood pressure, because it puts so much pressure through those fine arteries around our heart, coronary arteries, also through the carotid arteries. That combined with cholesterol is a lethal combination. High cholesterol, we all produce cholesterol, but high cholesterol is problematic because the body tries to shuttle it away into the intimal lining of the smooth muscles. And what can happen either with infection or smoking or stress or high blood pressure, you'll get a slight tear just on the inside wall of the artery, and that will allow a little bit of the lipid matter or the cholesterol. It's really lipid and white blood cells at that point, once it's been deposited there, will seep out, and that'll create a blood clot, and that's where the harm comes, because that will detach from the point that it originated at and either travel further up the brain if it's occurred in the brain, so you'll end up with a stroke, or if it's occurred in the coronary arteries, you'll end up having a heart attack. Family history is a risk factor, but one of those things that we say is not modifiable, so it's out of your control, really. Inactivity, definitely. Stress is a huge cause of heart disease and high blood pressure, and interestingly, high cholesterol as well, because cortisol, which we release when we're stressed, prompts the body to make this stuff. Emotional stress, quite high, and high homocysteine, which is a protein marker that can be measured in blood and is managed by giving the person folic acid and B12. Tests. So, testing people for heart disease, I just sent someone off yesterday actually Some really standard stuff that can be done is just taking their blood pressure, and you might be able to do this yourself. And ideally we're pitching for 120 over 80. 120 is how hard the heart has to pump when it's under contraction. So the more resistance there is to that pump being able to eject the blood, the higher pressure goes, because it's got to force the blood out of there, and that is a strained heart. The bottom number, or the diastolic, reflects how much or how relaxed the heart is when it's in diastole, when it's not pumping. And because the whole vasculature, so the blood, the heart, all the arteries going through the body, back through the veins, is a closed off system, there's always pressure in there. It does actually become negligent as it drips back into the right side of the heart. But you can measure arterial blood pressures. 120 on 80 is really what we should be aiming for. The American Diabetes Foundation recommends they have changed the parameters a little bit, but I think for good health you want to have a diastolic between 70 and 80. Look, even lower than 70. We know in some countries around the world, the blue zones by Dan Buettner, if you can get your diastolic, the bottom one, down to 60 or 65, that's a lot of relaxation for the heart, and you will live a lot longer and a lot healthier. You can check cholesterol, and if you're going to ask someone to get their cholesterol checked, you really want to know the breakdown. So not just the total cholesterol, but you want to know total cholesterol, LDL, which is the bad cholesterol. You want to know HDL, which is the high-density lipoproteins, which are the good protective ones, and triglycerides. And trigs are a very good reflection of what's going on in the person's liver and what they ate the night before. Blood testing, once again, I always request homocysteine because it is highly treatable and it's a greater predictor of heart disease than really cholesterol is. ApoA is also another specialised blood test which GP can order. ECG, electrocardiograph, measures the electrical activity through a heart. And it's non-invasive. You just put stickers on the chest. You might have seen it in some movies on emergency department. Strap the legs up, the chest up, and you can read, you get a good reflection of whether there's blockages in the heart, whether they've had a heart attack, whether there's old heart attacks, etc. A stress test is fairly standard nowadays, and most GPs will jump this step and go straight to a stress test. And that's doing an ECG, so an echocardiogram, while the person's exercising. And you can see then what happens once the heart's under duress, which kind of can mimic what's happening while they're going to work and other things, to see if it changes under stress. An echo or an echocardiogram is measuring the contraction of the heart muscle, and it's an ultrasound basically of the heart. You can also, it's a good determinant of valve function. So if someone's getting short of breath and swollen ankles, you want to see that the valves, the little flaps in the heart, are closing off properly, so the blood's continuing to flow in the one direction and not backtracking. So an echo will give you that information. Angiogram, now that's where they're starting to do a lot more radial angiograms, but the femoral ones are kind of standard. That's where they'll stick a little periscope either through the radial artery next to your hand or up through your femoral artery in your groin, thread it up, round, just pop it in the branch of the aorta, shoot some dye down, take some photos of the heart, and from that they can determine if there's blockages. And it's not uncommon for people to have 3 or 4 blockages. The heart makes things called collaterals, so it makes alternative pathways, so it can survive with some blockages in the main arteries quite nicely for quite a while, until one day that you get a little tear and then you make a clot. MRI for hearts, not as common but being done more, and diphthalium scans, etc. There's quite a few other more sophisticated ones, but they're the standard ones. How do we treat heart disease? I've got to say, for me, heart disease is a lot about lifestyle. This one particularly, the third one down, has really underestimated the impact that has on our body. And look, I had a lady here yesterday, and we talked about her life and what's going on in it, and she's had chest pain, and I said, it sounds like you're heartbroken. And she goes, I am heartbroken. And I thought, boom, there's the answer. And it was a psychological stress that was breaking her heart, and that used to be called it's not Tay-Sachs disease. There is actually quite a well-known phenomenon now where we know people can have heart attacks induced by psychological stress or trauma. So no physical thing, but just the fact they've had an absolute shock, or they get a broken heart because their lover leaves them, will affect the heart in a physical way, and they will suffer with damage. So this one, the stress awareness, is massive for me, and getting people to appreciate, and you'll hear me talk about it a lot, that down activities are just as important to throw into the mix as up activities. So up activities are all your things that generate a bit of a sweat and get the blood pumping at a high rate, get the heart rate up, squirt out heaps of adrenaline, noradrenaline, and really gut-busting, boot camp style, kicking boxing bags, blah, blah, blah. They're up activities. Now, whilst they can be a good stress outlet, they're not going to drop your stress hormones. And dropping stress hormones, excuse me, is really what we want. And down activities will do that. So things like yoga, meditation, tai chi, qigong, massage, reflection, painting, I call them green light activities, are very important for bringing stress down. Exercise is also quite pivotal. Up until probably 10 years ago, it was thought that nothing could raise the HDL, the protective cholesterol. Now we know that exercise does, fish oil does as well. Diet's critical. So I've got another recording on diet, but things that are bad for heart disease per se are saturated fat, so all the animal fats and palm oil, which are on chips. I think we're going to find that corn syrup is, even though it's a sugar, it can create fatty liver, and that puts a lot of backlog pressure on the hepatic vein, which will affect the heart. Carbohydrates for a lot of people are just ghastly things. They create a lot of inflammation, and a lot of people are starting to see heart disease as an inflammatory disorder, driven by grains and gluten and other things. This positive outlook, heart math. Now, heart math is coming out of the States. It's huge to train people. We're starting to see that the heart is actually the emotional centre of the body, not the brain. That's what I'm trying to say. So I've got a tickle in my throat. So teaching people about positive, I was saying before about the broken heart, teaching people to use different language, rather than saying I've got a broken heart, you could say, actually, it really did affect me, and I put my heart and soul into everything. Like, we've got to be very vigilant with our words and make sure we're not using them in a negative way. And for me, and maybe for you as well, correcting deficiencies with heart disease is critical to getting a person 100% better. Often overlooked. So, someone might be having palpitations. That's where the heart races. Typically, that's going to be a magnesium deficiency. Sometimes it can be due to iron or calcium, and omega-3s can mitigate it a little bit. A lot of those people get shoved straight on anti-palpitation medication, beta blockers, and other medications, when really, if we correct their deficiencies, they don't need those medications. So that's a little bit on heart disease. As you can see, I'm very passionate about it. It's highly preventable. And if you're seeing someone with heart disease, just encourage them that they're going to be in it for the long haul. This stress awareness and management might take some time to really seed into them. As well, the NLP, changing the linguistics inside their head and what's coming out through their mouth. These two should be quite apt at helping them with. Prostate cancer. Now, tell me there's not something in this. The incidence of prostatic cancer is 25 times higher in Australia, New Zealand than South Central America. Now, when you look at geographical distribution of diseases, there's a lot more the further you move away from the equator. Now, one postulate for this and one definite cause of this is vitamin D exposure. So more around people around the equator get a lot more sun exposure. Plus, there are very few big cities on that equator. Mexico City, yes. United Emirates, yes. But the other big cities tend to polarise away from it, and people in those places are living indoors. Super shopping centres, so they're not getting vitamin D. So not only are they not getting in the sun, but they're also staying in fluorescent lights, not getting in contact with nature. So prostate cancer is massively high in Australia and New Zealand, as is breast cancer and other vitamin D deficiency states. It's the second most common cancer in men worldwide, so it is a huge problem. Incident rates are definitely increasing. And interesting, the BMJ, which is a very reputable medical journal, it's one of the top 5 in the world, published a 20-year-old follow-up study showing that prostatic screening doesn't reduce cancer rates. Now, this is where it gets very interesting. So I haven't got a picture here, no. I'll just use the little cursor. So just behind the penis, where the testes are, just in here, there's a little gland which is called the prostate gland. It's the size of your nail bed on your little finger, or the tip of your little finger. It's quite small, but it plays a critical role in the body and helps inseminate semen. It generally will get larger as the man gets older, and a very high percentage of male Godivas, their dead bodies, are found to have enlarged prostates. Now, because of the proximity to the urethra, which is where the urine comes out, it can compress on that. So some of the early signs are altered urine flow. So guys will go to the urinal and they'll have not the same amount of force, so it'll be quite weak, or it'll flow on, flow off, flow on, or they'll urinate, leave, and then realise there's more in there that hadn't come out. So that's quite indicative. It can also compress on the pelvic floor. It can compress on the bowel and give a sense that the man needs to move his bowels. It can give leg pain as well, going down the top of the thighs, though that tends to be chronic benign hyperprostatitis, which is that's more an infective prostate rather than a cancerous one. But certainly within the prostate, the cancers that grow there are very slow, which is a fortunate thing. My observation and research indicates that most of them are due to high estrogen states in men and low zinc levels. So women, breast cancer, that's low vitamin D, high estrogen. Men, prostate cancer, high estrogen, low zinc, and probably low vitamin D too. Now, if a guy's going to go to a doctor and be checked for this, the doctor, and they do it on 40-year-old bloods here now anyway, on a 40-year-old check, will check the PSA, or the prostate-specific antigen, and it's a protein that's produced when the prostate gland's becoming cancerous, and it goes up. Interesting though, it's, as I said before, BMJ published this thing saying prostate screening through PSA has not reduced cancer rates at all. And in fact, it's a little bit misleading because PSA can alter for all sorts of things, and if it goes up, what the typical course of action is now is to go and do a biopsy. So they'll do a fine needle biopsy, usually through the belly into the prostate. It's quite close to the skin, so it's not too painful, but though a large percentage, or I shouldn't say a large percentage, a small percentage of those can actually go on and develop abscesses. And I've heard some horrendous stories of where the prostate gland's been fine, the PSA was misleading, and the person's ended up with major issues because of this invasive investigating that the guy didn't really need. PSA can go up with prostate cancer, but sexual intercourse will bump it up. Trauma, prostatitis, benign prostatic hypertrophy, which is when you get that enlarged prostate. The best way, really, it's kind of standard, a lot of guys don't like it, but is a finger in the rectum, and you can feel the size of the prostate, and it really is the best rule of thumb. So what are the risk factors for prostate cancer? Smoking, surprise, surprise. Being overweight, definitely. High sugar intake, because cancer loves high sugar, and cancer also loves acid environments. Hormone imbalances, so this is what I was alluding to before with the high estrogen and low testosterone. Now, if men are not low on testosterone and they're producing adequate amounts but are low on zinc, that actually will then get aromatized into estrogen. So zinc's so important for men. And zinc can be found, let's turn that off, zinc can be found in nuts and seeds, shellfish, very important mineral for men. Yeah, nuts such as almonds, macadamias, pecans, walnuts, pumpkin seeds, chia seeds, shellfish, oysters, etc., mussels. Poor nutritional status. So this is the office worker who lives on takeaway, not getting enough antioxidants at all, and they are sitting ducks for this stuff. When I wrote this, there was some evidence. Now it's overwhelmingly, yep, definitely mobile phones and ultra high frequency waves and EFCs cause prostatic changes and cause sperm changes as well in the testes. Laptops from the fallout, computers and microwaves all can create a change in the prostate gland. Modern day battle. Nutrient poor. There's really not a lot of nutrients in this fried meat, as you can see. It's calorie rich, so there's, 1, 2, 3, that's probably that'll be like a 1,500 to a 2,000 calorie burger, probably, just right there. People are drinking way too much grog. A lot of people are opting to drive when they should be walking. We're getting bombarded with herbicides, pesticides. Even in that meat there'd be a stack, and you can see the cheese isn't even real. There'd be, probably 20 or 30 chemicals just in that little burger there. And your body's got to try and unravel and decipher what a chemical is and deal with it. It really puts a lot of burden on the body. Emotional and physical stress. We're trying to get bigger, fatter, faster cars, and people are just chasing this elusive dollar and forgetting to have fun along the way. And negative thinking, believe it or not, plays a big role in our health and health outcomes. So just back to the prostate cancer, as I said, digital examination's good. You can test the urine. PSA is a bit misleading, and biopsy really should be the last resort. How do we treat them? If they come to me, this is what they get. They go to a doctor, they get different. Me, I'll check hormone status straight away and correct that, because, as I said, prostate cancer is very slow growing, and the body can heal itself from any place, I believe, given the right tools. So if your estrogen's up, let's get it down. If your testosterone's low, let's get that up and make sure you've got some good zinc on board so it's not aromatase. Medical options. If you go to the doctor, they'll try and, they'll offer to remove parts of the prostate, which is transurethral resection of the prostate. So they go inside the eye of the penis, up the urethra. They've got these sophisticated little gadgets that zit, 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 slice off the prostate gland. And I've been in theatre when they've assisted with lots of TERPs, and it smells. It just stinks, this smell of burnt prostate's yuck. It's like burnt flesh. They can do chemotherapy, and they can do radiation, and they can also insert radioactive rods up into the prostate, which shatter very much like radiotherapy or radioenergetic waves, and will shatter any cancerous cells. Unfortunately, it doesn't stop just with the cancerous cells. It will also kill good cells. TERP, I'm not too sure from memory what the erection dysfunction rate after it, but it's quite high. I don't know that it's 30%, but I know it is up there, and a lot of guys don't have the same erection after having these operations as they did prior. Zinc, excuse the pun, but it's mandatory, absolutely. B12 and folate, also quite good for prostate cancer. Mediterranean diet, for me, that's probably the best diet in the world, because it encompasses the fun, the rest after you eat, the whole lifestyle that goes around healthy eating can be found in this here. Now, some antioxidants that have been shown to be quite useful specifically for prostate cancer is green tea and lycopene, which is found in red tomatoes, and pomegranates. I should change that. So pomegranates are the fruit, and they are also been shown to be quite good for treating prostate cancer. A little bit of shock value never goes astray. People tell me iced tea is good for them. This is iced tea. Look how much sugar in 1 cup. Orange juice, pure orange juice, very high in sugar and fructose, and this is what's leading to lots of fat tummies in our young girls as they suck on these on the way to school. Not good at all. Too much sugar. Another little comment about how we're eating. 90% of food expenditure in 2010 in America was on packaged food. That's just 10% was spent on fresh fruit and veggies and meat. It's just unacceptable. Clearly we're eating chemical stuff that used to represent food, and for those who are old enough to remember that cartoon called The Jetsons, well, we're not far off it. These things just have to be squished down into a tablet form, and we're there. Healthy living can add 14 years, so really encourage people to embrace the fact that you can have a really healthy, active, longer half of your life if you look after yourself. If you don't smoke, if you eat lots of vegetables, if you're interested in consuming little bits of wine, it's been shown every day to be healthy for you, and to exercise every single day. Now, this one I find very disconcerting, and I've had to talk to a couple of my medical colleagues about this, and in particular young men and the use of marijuana in their formative years. So their opinion and research is starting to show out that young guys who are using this new hydroponic marijuana, where there's a lot of chemical, it's made under lights, not grown in fields, where it's very natural marijuana, chemical synthesized, fertilized, herbicide marijuana is quite toxic and poisonous to a developing young man's brain and can create a lot of anxiety. And certainly some of the ones I've tried to help lately, it's really frightening, really physically healthy, suffering and grappling with this self-doubt and anxiety that they're shaking and on antidepressants, and it's all of very high high incidence of suicide and suicidal ideation, which means they think about it. So 1 in 6 Aussie guys will suffer with depression at any point in time, and a huge component of depression is actually anxiety and shaking and jitters and that sort of thing. Mental health affects absolutely everything that you do and everyone around you. So it affects your work and your output and your approach to work. It affects your relationships, intimate, extended family, and it impacts greatly on your ability to earn and your physical health as well. So it's a huge area. I really don't think we're anywhere near getting on top of it at all. Signs and symptoms, look, questionnaires are quite good. To be diagnosed with depression, they use a DSM-4 category, which there's quite a few ways to diagnose it, but you need to have a couple of key criteria, and you need to have loss of pleasure in activities that you used to find pleasure in and a flat mood. You need definitely 1 or 2 of those. And then there's a whole range of other things that will go with it. So feeling worried or stressed or gaining weight or losing weight or becoming angry or irritable or withdrawn or drinking too much so you can escape, or gambling, or poor sleep, agitation, porn, gambling, sorry I've said that, escapism through Xbox activities, can all be, here we go, this is what I was after, signs that you're depressed. This is how they diagnose it. You've got to have one of those first 2 and then only 3 or 4 of these following. And look, there's 20 or even more symptoms, psychological things that people can experience that will lead to a diagnosis of depression. Panic attacks are feral. That's panic attacks are this overwhelming sense of impending doom and loss of control and feeling like you're going to die. So it's acute anxiety, and you shake. Then your heart's out, you hyperventilate. Then your heart will palpitate, which means it races along. Yeah. You can get carpal pedal spasm, where your hands spasm and turn inward, and you get this sense that you're going to die. I've had a couple on planes over the years, and they're terrible things. You want to jump off the plane because you feel like you're about to suffocate. Agoraphobia is an extension of it, spiders. Any acute aroused anxiety state can be classified as a panic attack. So what do you do, or how do we help young men with depression, or any guy with depression at any age, or anyone really? I encourage them to talk, because often just by talking they can release a lot of their concerns. And the trick to it as a professional, someone helping them, is to help them find certainty, because they're feeling depressed because they often feel uncertain and unsure about their future or even their own skin. So the more anchored and certainty we create for them, the better off they feel. And plain old talking can often do that. Naturopaths, great. That's where I come in. Doctors also, as long as they're well versed at treating depression, because you can't do it in 3 minutes. Personal trainers are going to pick up a lot of people because they're in that intimate headspace. Counsellors, NLP, personal development courses are also quite good. So there's this thing where if people can take the next step, which will be these are big challenges, but even if they just take a little challenge, which might be to go to the shopping centre once a week to start with, and then you build it up so it's every day, or going out to a restaurant or something that they find quite intimidating. By doing that excuse me, they expand their level of confidence, and that can do a lot to improve moods. You don't want to freak them out though, so some challenges are too much. And there's shedonline.org.au is that website that Department of Health and Ageing set up 2010, and a lot of resources on there. Vitamin D, it's going to get a mention in a few places. Really important. I've got there with women, but this is men. You need about 3,000 to 5,000 units a day. You can get most of that from the sun, but if you have to avoid the sun, then you need to supplement or eat foods in it. Once again, that if you have family history of prostate cancer, or you have prostate cancer, you want this level to be about 100, 150, even 200 is great. You want UVB rays, which are in the middle of the day. That's when the sun's right above your head and your shadow's very short. That's when you know there's UVB, and that's what you want for about 20 minutes. As I said, as long as you're not a high skin cancer risk. How do you know if you're a skin cancer risk? Well, you go along to one of those clinics where they run a little magnifying glass over your moles and say, no, you're fine. That's what you want to hear. Going to supplement egg yolks, dairy, cod liver oil, oily fish, alfalfa, dandelion, horsetail tea. Excuse me, eating fresh is where it's at. It says organic, and that shop there probably was about a $30 shop. People used to tell me how dear it was. It's not dear if you go to the markets. Be happy, very important. And lately I've been teaching, it's been an interesting week actually. So many of my patients have forgotten to have fun and how to be happy. So I've been actually brainstorming, can you believe it, how to have fun. We're trying to weave that back into their life. Be mentally fit, so important. So that's it for men's health. I hope that's given you a bit of a heads up. Don't feel you've got to have all the answers. Always refer on, and it's just really an introduction. But heart disease, as I've already covered, 4 out of 10 deaths in this country still are due to heart disease. Huge room for improvement. So good luck with it.